All right, welcome back, and we're joined by Ms. Phyllis Peoples, the CEO of Terrebonne General Health Systems. And I spoke with Phyllis not long ago, and you were really going through, and a lot of people were, but I mean, for our medical center, for me to see that video that was actually being shot and put out was incredible what y'all were going through. But we're going to talk positive today. Y'all been making leaps and bounds over there. I'm going to give you the floor, and I know y'all been working hard.
We have, Martin, and I'm real excited to show how Terrebonne General's definitely working very diligently to come back strong. I gave my team about a 30-day window to see how much we could get done in that 30 days, and we won't be exactly like we were. We won't, but what we can offer to the community in those primary care areas are really what we're trying hard to meet. People did see the video. It was quite a journey, and we call that kind of a ground zero because there wasn't a lot we could control that first week after the storm. We were evacuating patients. We were immediately trying to get up ER services. But by Wednesday, we broke into teams. We pretty much set our goals and what could we get up as quick as possible to help our community. So week one, which was last week, we set our sights on making sure we had emergency room services and that we're able to do things for people that are coming back because it took them a little bit to come back and they're putting themselves in harm's way or they might not have their medicines or certain things. We quickly recognized that oncology was a major deficit for the community, of course, but more so as our patients. They needed their treatment. And they had until like a Wednesday to be able to do that. So we pretty much powered through it, and we had our oncology, what do I want to say? Our oncology clinic was all up and running, and their infusions. So a lot of people who were getting treatment didn't miss a lick. And we've got our radiation oncology services now up too. What people don't realize is that it's not just as easy as saying, can you resume a service? When an organization has challenges, you got to make sure that you're able to check off a lot of boxes before you open them. Air quality, condensation, making sure that it's got air conditioning. Is equipment already been all quality checked to resume? Can you get people in a safe parking environment? Are there no hazards in the way? Do you have staff? We have a lot of drying materials and things all through there, and we're still doing construction. And especially for cancer patients, we wanted to assure all of that was done before we put somebody in a safe environment to assure their safety. So that was one of our main goals, and we've been able to achieve it. And people are back, and we got some good pictures to share with you a little later in the broadcast of some good, happy patients.
But you know, when you talk about it, we talk about every industry, including ours. Antennas would go down or equipment goes out or your building gets damaged. We can survive. In your business, it's life or death. So every decision that's being made is life or death. That's a lot of added pressure in there.
Well, we always are for I'm sorry, I'm still punch drunk from not going home yet, but everything is about the patient and the safety of the patient and the safety of our staff to be able to get people in, and we're going to protect that in everything we do. And so, yeah, it really does. And we've been able, people also don't realize this, as you're bringing up a service, let's say like oncology, I got to be able to have some radiology equipment available and lab. And our lab area's got some injuries there and a little bit in radiology too. So we made makeshift areas so that we could provide the care in those particular areas. The other thing is we got ER out there in our tents, and by the way, that will be coming inside the building on Friday, well actually Sunday. On Sunday, because our DMAT hospital will be, they've been gracious and wonderful, and they'll be kind of stepping aside over the weekend. And so that, again, allows us the opportunity. We've been doing COVID testing, and we've been doing vaccines already because COVID tends to get out there. That's our DMAT team, and they are part of the Air Force, the National Guard Air Force. And we quickly put them in all of our shirts, and they loved it because they love Homa, and they love the food, and they've been part of our family since they arrived here. And a nice, wonderful group of people.
That's a great shot.
It is a great shot, and they're pretty much part of us, along with our employees.
I was asking you when you came on, I said, did it sort of remind you, or I asked you if you watched MASH growing up, and you said yes. Similarities, right?
It is a MASH unit. We kind of called it Klinger City, but we didn't tell anybody that part. I guess I just
They
did.
know it now. Yeah.
I guess I just did.
Yeah,
But
right.
anyway, they've really been amazing. They've been an amazing adjunct to what we're offering, very much so.
Yeah. When you look at the scope of things, you said the governor's been in contact quite a bit. Talk about that.
We've really had some wonderful outreach. People recognize the level of injury that we've had in our community, but more so in our healthcare models here. And as we continue to try and get up, I speak to Warner, who is over all of the Ochsner system frequently, and Mike, who is the COO, and we're making sure that whatever comes up with us, also we're able to represent our community. The governor came in last Friday, called to say, can you meet with me, and went out to the airport, and it was just us. And his major concern are here are the key people, and he's done this multiple times, and what do you need to get that roof fixed, and what do you need to get services back, and how can I help? And from his level to all of his adjunct people around him have been amazing. They truly have.
Be remiss if I didn't ask you how the whole staff and employees are doing, because y'all really been put, not only COVID, but when you transition to this, I can only imagine.
Well, when Hurricane Ida hit, we had about 100 of our employees, as we stated before, in our organization or in our building during the storm. But we got a lot more people that are part of our organization, and we were concerned because the minute we went down, now you've got people who have a lot of damage to their homes. They're worried about their livelihood. They're worried about what's next. As Terrebonne General shows pictures and things like any organization, what will be our recovery time? And so we were real concerned about that, and that was a major thing for me. So we wanted to make sure that we could take care of them, and so I told all of them that we would guarantee their paychecks during that first pay period to assure after the storm, and we would assure that they had paid time off, kind of get them through a 30-day window. And so we wanted them to feel okay. The other things we did is that we reinitiated some of that little bit of vacation time that they could use to try and take some time as we're down too. But also we assured that they had gas, and we got a gas truck and things that we were able to provide for our employees. And one of the funner things, if that's the right thing, we looted. I'm not going to jail for it. We looted ourselves at the hospital.
Yeah.
You've got no power. You've got no electricity. We had no water. People are all wearing Terrebonne General attire. We got a lot of contractors there. So we want to assure who our people are that are in the building. And so we went and got all of our things that have our insignia on it and passed it out and shared it in the best of our ability.
Right.
And so it's been really, really good, but I'm real proud to say that's what drove us. I sat with my staff. I said, we can help them for 30 days. That means in 30 days, most people need to be back at this hospital to the best of our ability. And we haven't gone home. We're pushing that envelope a lot. And as of today, I'm proud to say, Friday, we keep count every week, and it's only 2 weeks after the storm. We just got water 7 days ago. I got 40% of my staff back.
Wow.
By next week, I think I'll have another 10%. That's my goal. And then my benchmark's around 70% because you had open positions and stuff. So if I can get 70% without still having my towers up and I can use them in multiple places, I'm proud of that. And people are glad to be back. They're glad to be back.
Let me ask you, because I said, I know you well enough to know that if you're going to do everything, turn over every stone, try to make everything happen, I just know your personality. But just like COVID, and I asked you this before about COVID, how does it, y'all are human. The doctors are human. The nurses are human. So when you're dealing with this and the stresses and the pressures and going through all this, they probably need somebody to talk to too every now and then. So the support has been pretty overwhelming, hasn't it? It's been good.
We think so. Look, this is a big hit to go from 18 months of taking care of COVID and taking care of others to now knowing you need to taking care of yourself. Because everybody got devastated in this. I don't think Ida left anybody alone. I think she was pretty good and thorough, and she touched everybody in some kind of way. And that's where they got family, let's hope, and they've got friends. But we got a lot of displaced employees, like a lot. that lost their total homes, over 100, 120, I believe. And so that's difficult, and we're trying to help them work through that, with the state and with Earl Hughes and all of those resources that are there. So pay became paramount, and benefits and things that we could provide. We're providing supplies and water and things like that. We'll have a consignment shop, or commissary is really a better word. Nobody will pay for anything that's donated to us. And we have an employee foundation. And what that is as people want to donate, if it's in a monetary value, all of that will be, people will apply for hardships or things and through our foundation. And we hope to be able to serve a lot of our employees who got the worst end of this.
Mr. Jim Donlin was just on, and he told me when it's all said and done, the amount of devastation and damage and monetary numbers will be worse than Katrina. And for the insurance commissioner to sit on his desk and say that, he said, it will surpass that. And that's when it hit me how bad this storm really was.
I believe that. I believe that. I think we were worse than Katrina. The difference is that Katrina was a water event, not necessarily as strong. I mean, it did have wind.
Yeah, more death, but not more damage. Yeah.
Right.
Yeah.
For us, you had Ida like to stay and visit us, likes the Cajun culture, I guess, for 4 hours. And for 4 hours in that magnitude of wind and rain, there weren't a lot of buildings that sustained that very well. And so a lot of people lost their fundamental primary things, which is their home and their livelihood, and all in the same swoop. Our whole community's injured that way, and that's difficult. We went down to Chauvin because we have a clinic already set up in Chauvin with Dr. Abu, and now we're able to provide pediatrics and endocrinology and several things. But we have people who want to donate food, so we sent it to Chauvin, and you could see right there, they don't have electricity, they don't have internet, they don't have phone. The way we let people know we're here is we provided food, and they went up and down the roads and they said, we're here. And look, I think it's a little interesting that we have this wonderful sign, but then somebody noticed the boat in the background. Heaven sent, I think.
Wow.
How you like that for interesting karma, right?
Yep, that's good.
And people, we ended up going there to feed just 500 people, 400. It was 800 that came through.
Well, that's fantastic.
And we're hoping to serve our community and outreach in so many ways.
And I want to run through a few pictures because what a difference a few days makes. But y'all have been really working hard. So let's roll through some of these and I'll let you explain.
Sure. Our ICU unit got hit pretty good with a lot of water. It's on the first floor. But as you can see, we've already got everything stripped to the studs. And we're putting back the sheetrock to get going. People don't realize that you see all those tunnels at the top. That's air conditioning or condensation removal, for lack of a better description, as you've got to have cool air in those areas to assure that it doesn't stay moist or wet. And so we're rebuilding those pretty quick. Those should come back, we hope, within a week or two. And I say that again, depending on our contractors, because people have been very receptive, and we're working people 24/7. They don't get to go home much, we're trying to get back up. The other pictures that you'll see coming up, I think, are patient rooms. We showed you the picture in the video, the first video, that our patient rooms were decimated pretty well with the windows blowing in. So you could see we had to take things down to the studs and bring them back. And we're already attempting to do that. There's the studs. The other one, we might just have to repair, some of the sheetrock. So we have our 3rd, 4th, and 5th tower rooms all down to those particular regroup areas. And as soon as we can get our roof patched or done enough, or it's safe, we will be rebuilding those. We don't want the rain to get them wet again. We're already doing services. We brought up all of our medical atrium building, which is all of our clinics. We're real excited about that. As of yesterday, so you're able to go to all your doctors who are located in the medical arts or medical atrium are open for business, which is our pulmonary, which is our endocrinology, neurology, internal medicine, our pediatric clinic across the street, internal med with Dr. Henry, Dr. Abu, Dr. Chestnut, Dr. Arsenault. Our OBGYNs are located in that area. We have several. Dr. Howard Russell, Dr. Channing Sanders, Dr. Pennison, and Dr. Michelle Andre are in that building. So anything that you see in our medical arts or atrium is open for service. We served over 250 patients yesterday in our clinic model, and we will be seeing more today. And we're ready to go. Now, you might have some bumps and bruises like you saw in the last picture of us repairing. And if you're patient with us, we're trying, but it is a safe environment. We've checked all the air quality. We've checked all of that. We minimize dust in some of those clinic areas. These are our maintenance guys that are always around our facility, guys trying to redo ICU, and they're not stopping and they don't go home much, you know? So they do it with a smile, always with a smile. Malcolm and Donald are a great, great team. They're a real part of our family. I think this is who we are right now. You can see our building in the background, but we have got ServPro, and we've got Lemoyne, and we've got a lot of different vendors all over our hospital trying to get us up and fast, and we gave them the direction that our clinics will come up very quickly, and they did. And this is Mr. Paul, and I always want to highlight Paul because he's an unsung hero through all of this. He does our plant management. For anybody who knows, if your operations aren't up, such as your electricity and your water, he managed all that. And he had a team of, I think, 2 or 3, and unfortunately, one of them got COVID and the other one was unavailable and got sick, really sick. And Paul stayed through the entire event and for many days after on 2 hours of sleep each night. And he still smiles that big all the time. So that just tells you we got great, great people.
You know, with about 2 minutes left when you were on last time, and I saw the magnitude of what you were showing me, and you were optimistic, and I was looking at it going, now I know she's determined, but when you told me 250 patients, that's incredible for this time period.
It is very incredible. Our docs are willing to, again, it's a lot of practices and a lot of people, and they're out there already scheduling them. We met today. We will be opening our OB services starting Wednesday of next week. We always start things on a Wednesday when I'm trying to bring up a service, and I tell you that's because Monday we're making sure there's no kinks and everything is finalized and the area is safe. Tuesday our staff comes in to get ready and people are scheduled, and by Wednesday we try and bring up the service. So we'll be offering limited OB services starting Wednesday, and so people can still deliver at home. That's been a big concern, that people might have to leave the community or leave the region or go somewhere else, and they got impending deliveries. And so we hope next week that will be a big part of what we're going to bring up. And then I've got all my primary services up and running for my most vulnerable populations.
Yeah, well, fantastic. Phyllis, we appreciate you coming and giving us an update. And I look forward to next week when you come and you give us another update, because every time you come, it seems like, and I'll say it again, a community without a health system, we can't function. We just can't.
I got a couple pictures of some patients. Let me show you that if I could.
Let's do it.
Just because it's just some of our first patients that already came back. And we got one of our cancer patients. Well, that's
wow.
Dr. Ralph Bourgeois. He's so excited to be back. He's celebrating.
Cool.
But we have one of our cancer patients who came for their treatment. And I think we have, there you go. And you know who that is. That's Lonnie Thibodeau's mama.
Yes.
And she's getting services, and she started yesterday, got her treatment, and she's ready to roll,
Amen. All right. That's a good way to end it on a good note. And Terrebonne General Health System back rolling again. Phyllis, we appreciate it. Thanks to you and your staff and your team. We appreciate you coming by.
Thanks always, Martin. I appreciate being on.
All right. There you have it. Phyllis Peoples. And we'll get her on periodically to give us those updates. And we got to keep positive news coming your way too. We have enough negative out there. We need the positive stuff to keep rolling. So we'll take a short break. We'll have a lot more here on Bayou Time. Don't go away.